subject vulnerability. This is a case we want to discuss with each other. Aim of the study, to study the effect of radiation on sperm function. Site of the study, Oregon State Prison. Time of the study from 1963 to 1971. Study population, 67 male prisoners who were mostly African American. Methodology, researcher X-rayed their testicle. Regarding the details of this study, it's written in many articles, and the methodology include, they will take seminal sample, they will take urine sample for hormonal assay, and conducting testicular biopsy 5 or 6 times, and by the end of the study, they did vasectomy. Regarding the social value, they consider it had high social value because the community may be exposed to accident. Another important thing, it's important to the NASA because the astronauts were exposed to radiation. On analysis of risk and benefit, the primary investigator stated that the benefit, each prisoners take or took $25 with each testicular biopsy. And at the end of the study, there is a bonus on vasectomy, another $25. Regarding the risk, which was written in the informed consent, they wrote that in the following next year, there will be no risk at all. Later on, you may suffer from tumor. Tumor, not cancer. The principal investigator was afraid to use the term cancer so as not to frighten the prisoners. Your thought regarding this research? Excuse me, one by one. Comment from this table. Yes, doctor? Why exploitation?
Because it's a vulnerable group and I'm not free for talk anything. There's a prison.
So we have to deprive all the prisoners from being a research subject?
Especially this, like this, intervention and vasectomy, I think it is, yes.
Thank you. Another comment?
First, he select an African American, not from all prisoners. This one thing. And as you stated that the risk it is not greater more than minimal risk. So he exposed the patient to X-ray, vasectomy, testicular biopsy, for what? For benefit of some group, which is maybe not related to the prisoner.
So you have concern that this research protocol does not respond to the health need of the prisoners. Maybe? Your concern?
I think the X-ray here is not therapeutic. There is no need to give, to expose those prisoners to X-ray. It's something like that you want to give a person cancer drugs, a person who don't have cancer, you want to give him cancer drugs.
But we may be exposed to radiation.
Mm-hmm.
There were some accidents all over the world.
Mm-hmm.
Also, we are very keen and we have concern about exposure of our astronauts to the sun flare in the space. So it's important to investigate this point.
You may take the natural exposure. You cannot, you expose them. You can take the natural exposure and those who are not exposed, and You may make follow-up or cohort study, not experimental study.
So you are worried about the radiation itself. Your comment?
Yes, thank you. I think there is a discrimination in the subject selection.
Why?
Why? Because they are focused just on the African American.
Yeah.
Yes. And as my colleague said, it is not an exposure for normal X-ray or therapeutic X-ray. There is a radiation, direct radiation, which we all know that maybe make cancer.
But you will not control the dose on normal radiation. You have to increase the dose each time and to know.
What is the social value for this study?
So you have concern about the social value. Yes?
I think we can apply this any kind of research in prisoners only if the disease or the accident related to the prison itself. So if we can apply this research in normal people outside the prison, we cannot apply it in the prisoners.
Thank you so much. Dr. Raya stated that we cannot exclude prisoners at all from being a research subject, but he's concerned that it does not respond to the health need of the prisoners. Any other comment? You are satisfied with the analysis of risk and benefit? Mahrous? You are satisfied with the analysis of the risk benefit as mentioned in the article?
No, I want to talk about the informed consent will be taken from this prisoners.
They are consent.
Yes, but they are, as we said, vulnerable group. They haven't their autonomy to decide what's to decide, how to participate in this research.
So all research in the prisoners, you will waive the consent?
I think it should be minimize the risk and explain all the procedures and give them the choice.
What's your opinion about the level of the risk in this study? It's minimal
above
risk?
Minimum, no, above minimum.
Minimal risk or
Above.
too risky?
High risk.
High risk? High risk?
Yes.
Why it's high risk?
Actually, I want to say if we want to discuss the risk and benefit for the subjects themselves here, I can see risks, but I cannot see benefit except for this $25, which is not a benefit.
Each time with testicular biopsy, they gave them $25.
Yes, but
and
we agree
by the end, another $25.
But we agree from yesterday that giving money to encouraging them being there, we cannot consider it as a benefit. It is some sort of, but it's not a benefit. It has to be benefit for the good welfare or health of the subject as well as the society.
But did it carry a benefit for the community?
It's for a certain group of people like
NASA
my colleague.
was very interested in such a research.
No.
Any other comment? My colleague stated that there was no direct benefit to the research subject, and it may or may not had a benefit to the community. Any other comment?
It might be the idea of the research subjects. Probably we can accept it, but not in this setting.
But not?
Not in the setting. I mean, it has more than one, as everyone said. Why is it only African American? Why is it only in the prison? If it's in the prison only, then we expect that this study should pertain to something that has to do with being in the prison.
Thank you so much. Any other comment regarding this trial? Dr. Fouad?
I think the researchers not explained to the prisoners the final consequences. They become infertile, and also the misleading term, the tumor.
To be honest, he explained to them, and we have to do that at the end of the study for fear of teratogenicity or mutagenicity, as this radiation may cause chromosomal abrasion, and we have concern about the next generation. He explained that. Umayma?
Why the researcher select a prisoner? Why you didn't ask other volunteer persons to cheer in or participate in this?
Thank you so much. Let us summarize your point. You have concern regarding conducting such research on prisoners, especially on African American. You have concern that this research does not respond to the health need of the prisoners. And you have concern about the risk, the level of risk, and you consider the dollars given to such prisoners, we cannot consider it as benefit. Any other comment? So, no need for the presentation. In the next few minutes, we try to answer some questions. What is the definition of vulnerability? Who are the vulnerable groups? And what are the ethical justification for enrollment of these vulnerable groups in our research, and how to protect them? In Science Guideline 13, define vulnerable groups are those who are relatively or absolutely incapable of protecting their own interest. They may have insufficient power, intelligence, education, resources, strength, or other things need to protect their own interest. In Helsinki 2008, subjects who are physically or mentally incapable of giving consent. Another definition, they are subject with diminished autonomy, and as Hani stated, autonomy that I have a mental capacity to understand and to process the information and to be voluntarily participate in this research without coercion or undue inducement. Another definition, it is a condition either intrinsic or situational that put individual at a greater risk of being used in ethically inappropriate way in research. Sometimes they tell the vulnerable group as a special population. The next questions, who are vulnerable group? I think all of them know that. They may be children, elderly person, pregnant woman and fetus, patient with life-threatening disease, as the case discussed with Dr. Silverman on the emergency setting, patient with incurable or fatal disease, as in research on advanced cancer, poor individual, dependent relationship, and some they stated that they are subject who are junior or subordinate member to the researcher. And we give an example of the professor in a medical school and the student, for example. Subordinate hospital or lab personnel, employees in pharmaceutical companies, or member in armed forces, and for sure prisoners. Mentally disabled, and here we have to differentiate between mental illness and the mental disability. Mental illness, for example, every now and then we may suffer from depression, but we are mentally competent. We can decide for ourselves. And mental disability as severe cases of dementia or Alzheimer. They cannot decide for themselves. Talk about decision-making ability. We have to understand, appreciate what they say to us, know the consequence for being enrolled in a research in research and have a cognitive ability to analysis of the risk and benefit, and then ability to communicate. And many individuals, as we said in the first day, have more one type of vulnerability. In this picture, they are children and the poor at the same time. Why there is ethical problem with research involving vulnerable groups, from your opinion? Why we have to take or give due care for research involving vulnerable groups? Yeah? Preventing abuse or from being exploited, to prevent exploitation. Any other concern? Not? To assess that it's voluntary. And again, the rule, who carry the burden and who gain the fruit, as in such case. It's important to investigate or to assess the effect of radiation on the sperm, but this problem, the answer of this health problem will be to benefit to whom? So these groups need additional protection. Protection from whom? This is the responsibility of the Research Ethics Committee. This is the responsibility of the principal investigator and from the subject himself or herself, so through direct informed consent or surrogate consent. Investigator responsibility. How? He has to convince the Research Ethics Committee that this research could not be carried out without vulnerable groups. How I can investigate treatment for eclampsia without recruiting a pregnant woman? How I can conduct my research regarding any disease affect only children without involving of children? This is the number one. Number two, this research on vulnerable group will respond to the health need. That's say it generate knowledge or any type of investigation that will help them to overcome this disease. The third point that, as mentioned in SIMS, that subject will ordinarily be assured reasonable access to any diagnostic, preventive, or therapeutic product that will become available as a consequence of this research. For example, as vaccine trial, has a minimal risk. But sometimes the Research Ethics Committee accept to be above minimal risk if it answers a very good question that respond to their health need. Regarding the consent, if they are competent, they will consent for themselves, and if not, we need surrogate consent. The responsibility of the Research Ethics Committee is to limit the level of risk. And yesterday, you did a perfect exercise regarding analysis of risk and the benefit in the investigational drug of hepatitis. And you give a broad idea about how to minimize risk regarding extended exclusion criteria, close monitoring, etc., and to limit the payment incentive. How to minimize the risk from the point of the Research Ethics Committee? Substitute invasive procedure with less invasive one. Use qualified personnel. This is very important. You will draw blood from a children several times. So it should be by qualified personnel. Necessary infrastructure to handle emergency, as the case yesterday. They did a bronchoscope in neonates, so should be conduct. We should have an emergency and monitoring, and again, keep the welfare of the subject. If I conduct my research in the newly born. So the Research Ethics Committee should assure that you will need this newborn for 2 hours every week. Do you have a special space and give a chance to mother to feed the baby or change the diaper? This is very important for the welfare of the baby. Consent requirement, we talk about that. Another point of vulnerability is the vulnerability in the international research between the developing countries and the developed country. And I think the picture is very expressive. And the guidelines stated that research subject in developing country may be exploited in the international research sponsored by the other country. It's not fair that population in the resource-poor countries suffer the potential burden of research without the prospect of deriving benefit when research demonstrates the safety, effectiveness of an experimental drug. To summarize what's written in the guidelines regarding the vulnerable groups and how to protect them, they are summarized in 6 points. Number 1, appropriate risk-benefit assessment. Number 2, capacity assessment of the research subject. 3, necessity requirement. Does it respond to their health need and their priority? Proxy decision maker, if needed, and respect of subject assent and dissent, as mentioned by Dr. Hani, and the independent monitor for the consent process. Thank you so much.